Tudor health and medicine in 9 minutes. The Tudor era began in 1485 with Henry VII and ended in 1603 with his granddaughter Elizabeth I. Tudor medicine had not advanced massively from the times of medieval England. It is thought that only about 10% of all Tudors lived to be beyond their 40th birthday, and one of the reasons, amongst many, was the poor standard of Tudor medicine and medical knowledge. There was a high childhood mortality rate. Up to 90% of children died of diseases, starvation, diarrhoea, and causes like a simple infection, which we have the ability to cure quickly now. Starvation was high amongst the lower classes. Warfare and pregnancy childbirth caused massive deaths amongst adults in the prime of life. Tudor England was rife with contagious diseases, and regular epidemics of dysentery, tuberculosis and influenza swept through the country. Although they killed off rich and poor alike, the malnourished masses were less able to fight off infection and more prone to death by disease. The richer you were, the better your chances, as they would have better food and they could physically escape an infected area. People like the king or queen would move from castle to castle so that the previous abode could be cleaned. The underlying cause of many of the Tudor illnesses was the lack of sanitation, especially in larger towns or cities such as London. There were open sewers in the streets, which were also filled with garbage. This was occasionally removed and waste was dumped into the nearest river, such as the Thames. Diseases were easily spread in this unsanitary environment, where fleas, lice and rats all flourished. There was no running water. This was obtained from water pumps, a main cause of the spread of typhoid. Disease prevention also affected a Tudor person's personal hygiene. It was believed water could infect people through their pores, so they cleaned their bodies by rubbing them with linen and cleaned their hair by combing it daily. Medicine was administered by different people. Your doctor depended on your class and whether you had the money to pay the fee. Only the very wealthy could receive the administrations of a Tudor physician, who would have received an education at one of the universities and the College of Physicians. The usual fee would be a gold coin worth 10 shillings, well beyond the means of most Tudors. Surgeons. Inferior to physicians, these had a similar reputation to the barbers, with whom they associated and belonged to the company of barber surgeons. Barbers. The barbers were inferior to the surgeons. Although they also belonged to the company of barber surgeons, they were only allowed to pull teeth or let blood or undertake minor surgery. Apothecary. The usual route that most people took was to visit the apothecary or dispenser of drugs. The apothecaries belonged to the Grocers' Guild and sold sweets, cosmetics and perfumes, as well as drugs. The church. The church provided some comfort for the poor. The local wise woman. The local wise woman was often the first person contacted by poor people. However, they had to be careful because if their patient died and they were accused of witchcraft, their lives could be taken. The Tudor housewife. The ordinary Tudor housewife used various herbs to produce homemade medicines and potions. During the times of a plague doctor might be appointed for certain towns and villages. They had very little medical knowledge. The plague doctor would be completely covered from head to foot, even his face by the ghastly mask. Stout boots and gloves covered his hands and feet. Tudor physicians wore long dark robes with pointed hoods, leather gloves, boots, and the most bizarre masks featuring long beaks, which were filled with bergamot oil or herbs. Amulets of dried blood and ground up toad were worn at the waist of the Tudor physician. It was their custom to douse themselves with vinegar and chew angelica before approaching a victim. Although this might sound pointless today, these precautions would have protected the physician. The bizarre and gruesome physician mask would have acted as a protection against contracting disease through breathing the same air as the victim. Neither rats nor fleas could easily penetrate these defences. medicine was basic. Physicians had no idea what caused the terrible illnesses and diseases. The belief about the causes of illness were based on the ancient teachings of Aristotle and Hippocrates. The physicians paid attention to a patient's bodily fluids called humours. Other beliefs of the Tudor physicians centred around astrology. The best they could offer was to bleed the patient or administer a concoction of herbs. Tudor illnesses were similar to the illnesses of the modern age, but before causes had been identified and cures identified. In addition to this, there were outbreaks of terrible disease such as the bubonic plague and typhoid. Broken bones, wounds, abscesses and fractures were treated in unsanitary environments, making the condition even worse. The only cure for toothache was having the tooth pulled without anaesthetics. Amputations were performed by surgeons. The stump was cauterized with pitch. Poor living conditions and poor diet led to many diseases suffered by both the wealthy and the poor. Anemia was common, as was rheumatism, arthritis, tuberculosis and dysentery, known as the flux. Childbearing and possible childbirth fever was dangerous. Many Tudor women made arrangements for the care of their children in case they themselves died during childbirth. The white makeup applied by the upper class women was lead-based and therefore poisonous. Tudor women who applied this makeup were often ill, and it was used in sufficient quantities. It would result in death. The upper classes also suffered from gout. Influenza was common, referred to as the sweating sickness. Letting blood was a common treatment, which consisted of using cupping or leeches to extract blood from the patient. Other medicine used included: bubonic plague was treated by lancing the buboes and applying a warm poultice of butter, onion and garlic. Various other remedies were tried, including tobacco, arsenic, lily root and dried toad. Head pains were treated with sweet-smelling herbs such as rose, lavender, sage and bay. Stomach pains and sickness were treated with wormwood, mint and balm. Lung problems were given licorice and comfrey. Wounds were treated with vinegar, used as a cleaning agent, as it was believed it would kill the disease. Anne Boleyn survived the condition, but Henry VIII's chief minister Thomas Cromwell lost his wife and daughters to the sweating sickness. Henry developed a deep fear of contracting the disease, breaking up the court and moving whole residences to try and avoid it. When Elizabeth I contracted smallpox, the up-to-date method of cure was to wrap her in red cloth. Finally, the Tudors saw disease as a punishment from God. Did you find Tudor medicine barbaric, or some of the cures rather silly? Have we got cures for everything, even today? Please let us know in the comments below. Tudor Health and Medicine in 9 minutes. Please subscribe, like or click on the bell to be notified of other upcoming videos. Thank you for watching. See you soon.